Hi, I'm Miriam Smetak. I'm a neurotologist here at UCI Health, and today we're talking about cochlear implants. So one question patients often ask is, what does this entail? How long is it going to take for me to feel better? And what's the process? So a cochlear implant surgery is an outpatient procedure. It takes a couple of hours. You go home the same day. It is under general anesthesia, so you'll need a ride home. What we do is we make an incision behind the ear and remove some of the bone behind the ear called the mastoid. Don't worry, you won't miss it. That allows us to get to the inner ear. The cochlear implant, part of it sits underneath the skin on the skull, and the other part is an electrode array that is coiled inside the inner ear and tells your brain what to hear. Like I said, it takes a couple of hours, but generally patients tolerate this really well. It's not a particularly painful procedure other than the incision behind the ear. And most patients do really well with just Tylenol and maybe a couple of pain pills. So fairly easy recovery. Sometimes you can feel dizzy after surgery. That's probably the most common symptom that bothers folks after surgery. And that generally settles out within a day or two. Usually we tell you no heavy lifting for between 4 and 6 weeks, just to let that all heal up. And then you'll go home with a dressing right after surgery that generally comes off within a day or two, and just a small incision behind the ear. If you have any other questions about surgery, or if you may be a candidate for a cochlear implant, please give us a call. We're happy to answer any of those questions and navigate that process for you.